We met, I'm Juliet, I'm a physiotherapist and I work in the community with people who've had stroke and other injuries, and I also work in research here at AUT University. We're going to just talk about and try a therapy that some people use after their stroke to try and get their hand working better. Now, the way that we know that it really works from the research is with very intensive therapist involvement. The constraint therapy, which is what we're going to look at today, is normally for 2 weeks. You have a therapist helping you one-on-one for 6 hours of every weekday, and as well as that, we try and stop you using your less affected hand for 90% of the waking day. So it's very full on. Okay. So that's the way that we know it definitely works, to help people use their stroke-affected hand better. Okay. But we're going to try some things that people might want to try at home, because the idea is the more you practice with your more stroke-affected hand, the more your brain learns how to use it more like you did before your stroke. Okay. So what we're going to do is we're going to use this bag to cover your left hand, and we're going to practice some things to help you use your right hand a bit more. Okay. Right. Now, in the clinic, when I'm with someone and we're doing something like this, we might use tape on their hand. If you're at home, you could use your other mitt. Just something that's going to stop you being able to use that left hand and really help you concentrate on using your right hand. Okay? Good. Right. Now, I just want to see how much movement we have in your right hand. Can you open up your hand towards me? So try and bring that wrist back. And again. And try and straighten up your fingers. And relax. Okay. So this therapy is for people who have some hand movement, because we want to try practicing everyday things. Okay. Right, the first thing we're going to try is moving some small objects around. So I'm going to help you with your arm, but with your right hand only, I want you to lift up a block, one at a time, and transfer it over to the other side of the box. Okay? Also try and find things that you'd normally do at home, like pulling tissues out of a tissue box. So let's try that. Good morning. Okay. Good. And we want to practice that at least one more time. So again, for the brain to learn, it needs to do it lots and lots. Okay. Right. Another really good way for the brain to relearn things is for both hands to work together. So I want you to put both hands on this cloth, good, and trying to use your right hand equally with your left. We're just going to push the cloth out like you're cleaning the table. So if you're practicing at home, it's really good to do things with two hands, but you're really trying to make your right hand work really hard. And the last thing, just with your right hand, can I get you to fold up the cloth more? Good job. And again, we'll be practicing that a lot whilst doing this therapy with you. Thank you very much, Lynette.